My name is Des Lockley. I'm Secretary of Edinburgh Trade Union Council, and this meeting is one of a series of meetings that we have having, which is organised by our ETUC COVID committee. And there was a gap over Christmas and New Year, but now we're restarted them. And we've got a programme of meetings on various subjects, I think right now to the end of March. So I've got a personal interest in this subject because my own union branch, which is Unite Edinburgh Not-for-Profit, organises social care workers in the not-for-profit sector. And so I've got a particular interest in this, and we're keen supporters of a Scottish National Care Service. So that's me as chair. But I've got to ask Nick Kempe to speak to us, who is, I'm not an expert, but I think he is a real expert in all this. And when I sent out the email inviting people to this meeting, I described a little biography of him, and so that I think everyone will know. He's spoken to us before. I think everyone will know his background. I've asked him to speak for 20 minutes to introduce a debate really on three themes. One is what is still going badly wrong in social care in Scotland, forthcoming Feely review, which we understand has already been produced and will be sent to Jean Freeman on Friday, but won't be actually published till next week. But apparently it actually does exist at this point in time. And then finally, the final theme is the issues involved in setting up a national Scottish care service, which I think, apart from the Tories, all the main political parties in Scotland are in favour of. And apparently, according to the Daily Record, or was it the Herald, 70% of the people in Scotland are in favour of. So it's something that should happen, but we'll have to see how it's handled politically. But with that introduction, I can call on Nick to kind of brief us on the three themes I've talked about.
Well, thanks very much, Des, and thank you very much for inviting me to speak to you again. So I can't see myself on the screen, which is perhaps a good thing. But just people, please let me know if I'm talking too. I tend to shout, so if I'm talking too loudly or anything like that. I feel a slight fraud being here, actually, because I at the moment, although Des's introduction describes all my management past, I've very much become a campaigner. Right? I think I've left all my management behind. I'm never going to be employed again. And I'm really now committed to working with other people to change the care system in Scotland. And why I feel a bit of a fraud being here is because actually there are a number of people in the audience. Des and Carmen has been on the, and Kathy have all been on the working group that I convened for Commonweal that has been trying to develop a blueprint for a national care service. And I've certainly learned, I'm sure, as much from them as the other way around. But anyway, I really appreciate being asked to speak. So I think we have to look at this, that the crisis in care at the moment is part of a much wider crisis in capitalism, and that which has actually been precipitated or it's got worse because of the COVID crisis. And I mean, I think some of that was illustrated yesterday. There was an article in the Herald by Jamie Livingston from Oxfam, Scotland, and it was about, on the one hand, how the top 10 in the world have seen their personal wealth increase by 400 billion, which is enough to vaccinate everyone in the world and do a heck of a lot of other things too, and pointing out the complete lack of any of the outcomes in Scotland, the Scottish Government's national outcome indicators that relate to care. And he was suggesting we need to have an outcome indicator that relates to care, and we need to make care central to what government does in Scotland. And I think it's worth, there's appreciation of the need for this, I think is actually gathering across the world. And one of the things that's happened in the last 10 months is a whole lot of people have been writing books about the place of care in society. And I can send links around afterwards, but there's a care manifesto, the crisis in care, there's a whole lot of book people who are writing. And the important thing about this is what they're saying is that care is fundamental to human existence. We're interdependent human beings are interdependent. We rely on each other. Our existence depends on each other. And that, to a greater or less extent, depends on us caring for each other. And that is, if you like, being posed to the whole neoliberal narrative at the moment, that individuals are somehow, they're discrete autonomous units who are there to consume things. And so what we've got at the moment is, which I think is very healthy, we've got a sort of a development of an alternative narrative to that has actually driven the care system for the last 20 years. So where we're at the moment, and I mean, people will have heard the news today, 100,000 plus deaths in the UK. Scotland is 6,500 deaths last week, and the excess deaths over the sort of average years, over the last 10, 20 years, is 6,500 excess deaths too. So we're in a pretty awful position. And at the moment, although the deaths in Scotland are not quite as high as they were at the first part of the crisis, this latest outbreak of COVID is actually lasting longer, right? And I think at the end of the day, it may well be that more people have died than in March, April, May. We'll have to see about that. But the key thing about that, I think, and the reason for that is basically very, very little has been done to address the issues that led to the enormous number of deaths in the first part of the crisis. And those of you who are at the start with Des talking about the Braid Hills nursing home in Edinburgh will realise that basically the care inspectorate was chasing that home for months and they didn't, and nothing changed. So I think where we are politically, if you like, is the only solution that the politicians have, and I think that's the same in Scotland and in England, is a vaccine. And what it's worth, and I'll just run through quickly what hasn't been done, if you like, over the last 9 months. Right? Well, most importantly, government hasn't learned from what's gone wrong. Instead, what we've had a couple of reports from Health Protection Scotland, which said that the discharges of people who might have been infected from hospital, there was no evidence to support that had led to outbreaks of COVID in care homes. We had a report from the Care Inspectorate, which in about September, which said that the health and social care partnerships have been doing remarkably well in the circumstances. And that was then followed by a report from the Scottish Human Rights Commission a couple of weeks later that actually said that most people living in their own homes have been abandoned during the crisis. So it was totally contradicted. So we've had a whole lot of misinformation coming out from government, really, about what's really been happening. And that hasn't been helped in Scotland. And I think we're in a worse situation than England there, is that the voluntary sector has actually been generally remarkably quiet about what's going on. So in terms of the workforce issues that haven't been addressed since the first part of the crisis, and everyone here will know that, but you know, the fundamental conditions to do with turnover of the workforce pay, the testing of the workforce is still very problematic, partly because they don't recognise things like in care homes, it's very, very difficult to test staff because everyone's on shift. So how you organise the testing is very, very complicated, but there's still very practical issues about that. And most important of all, I think, is the workforce feels totally unsupported. And there was a fantastic piece of research that just came out just before Christmas from the University of the West of Scotland, and it's called Decent Work in Scottish Care Homes. And I'll just read a short extract from it, because it says, out of 7 job quality factors specifically examined in this report, care workers told us that 5 factors had worsened during COVID-19. These relate to supportive managers, terms and conditions, a safe work environment, decent pay, and job security. Now that's just a complete telling indictment about what's going on in the system. We've had, and we touched on at the beginning, that there's been a massive failure in regulation. The Care Inspectorate, I believe, and they unfortunately don't put out data about this. They just report how many inspections they've done each 2 weeks to Parliament. So you have to end up counting the inspections individually to see how many care homes they've looked at. But I think at least half of the care homes have still not been looked at 10 months later. And they're inspecting places for the first time to find out that staff have never been shown how to put on protective equipment and so on. It's not staff's fault, it's a total failure of the system. And the ethics behind this, if you like, or the ethos of government behind it is, well, we should just leave government, we should leave the market, the private market and voluntary market to get on and deal with things itself. And indeed it has. We can touch later, you know, trading in the care market, people selling businesses for profit and so on has continued as though nothing's happened at all. And it's the last bit about the continued failures I would touch on is in terms of rights. We still haven't got any decent solution for how relatives should be able to see care home residents. And I mean, I find it quite staggering that with the vaccine now, they don't even seem to be plans to say that when older people in care homes are vaccinated, how they might be able to see relatives again. And I know some people are doing things, but on the whole, the general position about contact between people is dire. So that's the sort of position. Nothing's changed very much in my view. In terms of the independent care review under Derek Feely, that was set up on the 1st of September by the Scottish Government after it was being subject to quite a lot of pressure. It's got a very wide remit, including looking at the possibility of a national care service, and Des has found out the report's probably going to come out on the 5th of February. Now, in terms of what it's likely to do, signs aren't very good. Last week, Jean Freeman, the Cabinet Secretary for Health, said that she wouldn't nationalise care. And I mean, what was frightening to me behind those comments was that she basically said, well, while I have control of the NHS and I can do things about that, I don't have control of the private sector. I really can't control what happens there. You would have thought, well, the logical conclusion from that, therefore, is, well, if that really is the case, I used to be involved in contracts and commissioning, so I think you could probably exert a bit more control than she thinks. But if that really was the case, well, that's the absolute argument why you need to nationalise that sector. I've been doing a little bit of investigation into Derek Feely's background, and I think it's just worth knowing, just so that people aren't surprised about what's going to happen. I mean, he was chief executive of the NHS in Scotland and was responsible for health and social care. He was therefore responsible for quite a lot of the work that's led to the current system and the integration of health and social care. He left Scotland partly after a waiting list scandal back in 2013 and went to something called the Institute for Healthcare Improvement in Boston in America. Now, what people need to realize about that is, of course, healthcare improvement in the United States isn't like improvement in the NHS, it's improvement in what's a fundamentally private system. So I think his whole background, the whole assumption is that there should be a private system. And he's actually been engaged by the NHS here. The Institute of Healthcare Improvement was engaged to do some work on patient safety programs and so on in the NHS. That's actually referred to, some of those programs actually put a lot of pressure on staff in Highland NHS and led to the bullying scandal that was investigated by Sturrock, and there's a whole report on that. But I think all of these things, it just looks like his background is about how do you do more with less. It's all about the sort of Blairite improvement program that has been taken up by the SNP and has dominated Scotland for the last 20 years. And it hasn't worked and it won't work. And we need to be really pretty worried about what the review might say. And the other thing to say about the review, and looking at them, the minutes are public, although they tend to come out a bit behind schedule. But the advisory group on the review was very much committed to a human rights approach. And I mean, everybody thinks human rights are a very good thing. And so they are, they're really, really important. But actually, they're very problematic when it comes to applying them to care. And in the Common Weal group, we've been doing quite a lot of work on this. But basically, the provision of care is about maintaining good relationships. It's about relationships between the person who needs care and the person who's helping them. And you can't have a right to a good relationship. I mean, what's crucial is about people's attitudes, skills, understanding of each other. It's very, very difficult to reduce that to a framework of rights. And I think the danger about what's going to happen is that actually rights will get interpreted as being about consumer rights, and basically we end up with a perpetuation of the current sort of neoliberal system and self-directed support, which I was involved in trying to implement and now think's an absolute disaster. It was about giving people a right to choose services. And just to illustrate the concerns about this, I'll just, Scottish Care, the organisation who represents care home providers in Scotland, just happened last week to bring out a report on human rights in care. I'll just read from it, but personal choice is part of the DNA of social care. The individual person must be able to have voice and agency in not only the care and support which is undertaken for and with them, but must be the primary actor in such conversations and decision-making processes. The importance of that is, of course, a lot of older people having care have dementia, and it's very, very difficult for lots of people receiving care to express those opinions. But he ends, after talking about this, an option of one provider of care in a monopolistic state-led model is not enabling of individual choice, even if it is contended that choice lies within the limited offer available. In other words, what the providers are trying to do at the moment is say, to defend their own existence by saying that people should be able to choose, providers choose to be ripped off by people based in tax havens in other parts of the world. And it's going to be very, very interesting how Feely deals with those issues, but I'm not very hopeful. So I just want to come on then, the last bit is about a national care service. And this is what we've been working on within Common Weal. And why we think it's important is we think that to get people talking about care, we need to offer a vision, hope for the future, a really big idea. And actually, we know that the NHS, it just resounds completely with the population. And the way I think we're going to get out or reform the care system is if we try and have a similar idea about care, hence a national care service. The background to the idea was basically, actually, it originated as a Blairite idea. And it originated in an idea that actually, gosh, if we can get people to pay for their own care by paying some extra insurance, paying into insurance funds, and we can get them to do this by saying it's all going to be for a national care service. That didn't get very far. But actually, interestingly, the Labour Party under Corbyn took the idea and developed it and made it into something completely different. And basically, they were saying people should have a right to, people have care needs, they should have a right to free care, but they said very little about how that care should be developed. So it was, they had some very good ideas, but it wasn't really articulated. So what we've been trying to do in Commonweal, and we're working on at the moment, is a blueprint for a national care service. And we're arguing something that's from cradle to grave, that in other words, something that offers hope to the whole population and also security to the workforce, and ends the fragmentation of care between children's services, addiction services, adult services, and so on. And the other sort of fundamental on this, and I'm going to basically focus from now on for the rest of this on how it might affect the workforce, but our assumption is that we need to get to a position where people have a right to have their care needs met. Rights are important, but it'll only work if you have a right to have your needs met and that's properly resourced. So from that starting point, we've looked at, and some basic things. I mean, everybody knows the appalling pay in the care sector. Our starting point is that care staff should move to local authority rates and conditions, and then after that, pay should be subject to collective bargaining, right? But I think the things I would like to touch on, though, is are other aspects that we're talking about. That go beyond pay, that we think is essential for good quality care provision. So, I mean, part of it, and part of what a national care service could do by being national, and it might be run through local authorities, is it should give people job security. At the moment, and in my own work, I dealt with situations where people have been employed on direct payments, and the person who was employing them suddenly decided didn't want a direct payment any longer, and those people were just faced redundancy. We need a national care service could actually just give people job security that doesn't exist at the moment, far more akin to the NHS. We're looking at training. And one of the appalling things at the moment, really, I mean, it's unbelievable, is that you can get a job in the care industry, and you can basically walk into a job without having any training at all. So what we're looking at is we're looking at recommending minimum amounts of paid training before people start work. I think what that is needs to be determined by the needs of the people who are in the workforce about how much it should be, but also minimum number of training days each year. We're talking about 2 weeks minimum. I know doctors, basically junior doctors, get 20 days training each year, so asking 10 for the social care workforce isn't very much. The type of training people receive is really important. At present, a lot of the training, and health and safety is very important, but a lot of the training provided, like in moving and handling, the reason that providers do that is really to protect themselves rather than help the workforce. They don't want to be sued, so they put in minimal training on techniques and so on that's required, rather than, for example, what you might need to know to work with someone with dementia. So again, we have this situation where you may, on your first day working in care, you could be sent to care for somebody with dementia who had quite aggressive behavior in their own home. You can basically go into that situation by yourself, completely unsupported and completely unprepared. The more you think about it, it's madness. The other thing about training is it would help create a career ladder for care staff, which doesn't exist at the moment at all. But as important as training is support for the workforce. I will finish in a couple of minutes. What I've been looking at the Scottish Social Service Council disciplinary hearings, and throughout the COVID crisis, basically they've been churning through disciplinary hearings of people in the social care workforce. There are dozens of them, and it makes absolutely shocking reading. I mean, to give one example, there was a guy there, and he'd locked a service user out of their toilet. So someone, and that absolutely shouldn't have happened. But the person had started work 3 weeks previously. He obviously was totally unsuited for the job, but he'd just been allowed to walk in and work with this person, and then he was being blamed for getting it all wrong, and his name was sort of being, going on a register of people who can't work in social care. And you're thinking, actually, managers should have never ever allowed that situation to happen. The other key things about this is that staff need time to work. With this time and task that happens at the moment, that people are given certain tasks to do and not allowed to do anything else. It just doesn't work. And we need to be thinking a lot more about empowering frontline workers to take decisions along with users and carers. So at the moment, frontline staff are sent out to do a certain task, and if they don't do it, they get in trouble, even though the person who they're looking after might want to do something else. They might not want to have their meal cooked that day. They might not want to just sit down and have a bit of company and have a chat. But if the worker does that, they're going to get into trouble. And we need to change the whole way care is delivered around. I'm aware I've probably gone past my time. I'll just say that in terms of the workforce thing, I think what's really important is you cannot separate the consideration of workforce from the other things we're thinking about. So we have to think about workforce also in terms of people who use services, informal carers, and how all that fits together into the wider system. Thanks very much.
Well, thanks, Nick, for that sort of, I think, to me, very interesting contribution, and touched on a lot of things that are going on at the present time. I know that there are people here tonight who have, well, I know they've got strong views on a number of the things you've touched on, and hopefully they'll articulate these views. So I started off by inviting people to put their hands up if they either want to ask Nick questions or that they want to make comments. I have got my own questions, but I'm not going to ask them first unless no one else wants to start the ball rolling. But does anyone want to start off with either a question or make some comments? Anyone? Well, there's Mary there. Mary?
Hi. No, I just wanted to say that, I think, that was really interesting presentation. And, I think there's just so much in there, and everything is in such a mess, which I'm sure there's people that work in social care who could articulate better than me the mess, that it's in. And I come across social care workers quite a lot in my line of work. And what I find horrendous is the, time and task stuff that you were talking about, where people's needs and rights are just being, just cast aside, and the burden is on, the care worker, who's trying to do as much as they can, be empathetic, compassionate, do the job, and are under, such time constraints, and know that, that the person that they're caring for needs perhaps their company or a bit of attention and a bit of an exchange, and they can't give them that. And a friend of mine actually used to go back to the houses that she had visited during the day and sing a wee song, and maybe take something, and I was saying, don't do that, Teresa, because you're going to get into real trouble. And she couldn't, she just couldn't cope with the lack of humanity in the system. and it is now just looking to give up because it's just so awful. So it was also interesting what you were saying about Derek Feely, you know, and his background, because you know, we've had as a union input into that, Unison of input in, and GMB, etc., and the Fair Work Convention, which I'm on, and produced the social care inquiry recommendations. And so, you know, I'm not surprised what you say about Jean Freeman, because I know that when we came up with our report, let's say she was less than interested in taking forward any of the recommendations on it, and has never been, you know, one that's been very supportive of trying to reform that area until recently. However, we have had some indications that the report that's coming out is going to move on some of the areas, like you know, having a sector level body that will look at training, look at qualifications, benchmarking jobs. But anyway, that's all hearsay at the moment. I'm sure Carmen can say a bit more, because I think you were involved in it, Carmen, as well, in terms of inputting and giving your views on what it was like as a social care worker. Anyway, I've said enough, but you know, it's you know, there's a lot there that you know, for discussion. So thanks for that.
Oh, thank you, Mary. Anyone else want to come in? If not, I'm gonna.
Des,
Yes.
after you is okay. Just a wee comment. I think Nick said something really important. Is about the instability of work. And SDS, I think we need to be aware that nowadays the only people receiving support through SDS are people that meet the substantial or critical criteria. So that means that they are about to go into hospital, or they are gonna die. I mean, that's kind of how it's working. And the local authorities they do provide support mainly under option 1 and under option 3, that basically are, 1 is the cheapest one, option 1, and 3 is what it gives more control to local authorities, because it's the local authority, the one who chooses the provider. So it would choose obviously the cheapest one. So if you are working under option 1 with this kind of clients, a situation happens that you would have more than one employer, that they could go to hospital or they could die. So there is not big stability in the job in there. And with the option 3 as well, the local authorities, they can take off contracts from providers with a 48 hours notice. So that means that providers are not very keen on recruiting people on, like, with permanent contracts, and they tend to get people on 0-hour contract or rely on agency workers. So there is a way where, for me, is the gig economy is getting into the sector as well.
Thank you, Carmen. Anyone else? Okay, I'd like to ask Nick a question now myself. I think one of my fears, I've got many fears about social care. One of them is that, as I've read, that the services will have to expand by like 30 or 40% between now and 2030. My fear is that from right now, the expansion will be met by the private sector. Unless we do something about it, the expansion will be met by the private sector asking to build more homes, acquire more homes, and that if we don't do something about it right now, even before like nationalisation, we'll see a gradual expansion in the private sector. And I just wondered, before we get like a national care service, how do we stop this expansion of the private sector and providing care homes and other services? So how do we do that? How do we put a stop to the growth in private sector involvement? And how do we get the Scottish government to fund, if there is going to be an expansion in services, how do we make sure that that isn't taken up by the poor performing private sectors? That's my question to Nick.
Yeah, it's quite, well, I think you've hit the nail on the head, Des. I mean, the problem with the current system at the moment is that the private sector is cheaper with worse, far worse paying conditions than the public sector. And the government has been looking at for the last 20 years at the increasing numbers of older people, saying we can't possibly afford to pay for all of that. And that's exactly what's helped drive outsourcing, right? So, and of course that problem hasn't gone away. I think at the end of the day, I think this is political. I think, you know, when you say, how do we stop it? I think people need to call for it to stop and say, actually, the private sector shouldn't expand any further. I think the situation in respect to care homes is actually quite complicated, because actually care home provision hasn't increased really in Scotland for the last 10, 15 years. It's more or less stayed at the same level. And what's happened is that as demand has increased, they've kept more and more people out of care homes at home. Then the knock-on effect of that is that those people who are at home need a lot more help. So everyone who needed lower levels of help have just stopped receiving service at all. I mean, I think the situation is, well, it is collapsed at the moment. They need to put in a huge amount of extra resource. And I suppose the key issue around that is where that resource is going to go. So that doesn't really answer your question, how we're going to stop it. I suppose I would just agree with you. I think we have to stop it.
Thank you, Nick. Any other?
Des, Chris Wright was trying to speak, and I think Mike, Des, I think if you unshare, you might be able to see everyone, because you have your screen share. Yeah, and then you can see when people are waving. So I think Chris Wright was trying to wave, and maybe Mike as well.
Okay, Chris first, then Mike. Chris.
Hi, thanks. It was a really interesting summary. I'm a carer. I worked in a nursing home, and been an interesting year. Certainly worked through a couple of outbreaks already, quite dispiriting, and staff are really stressed and demoralized. It's almost worse now because it's just gone on for such a long time. What I was going to ask about is the issue of resource you just mentioned, and you said the question is where it's going to go, but it seems to me that the question is also where is it going to come from? You have, at the moment, as I understand it, a means tested system, which means that the state does pay below a certain asset wealth, and that the vast bulk, presumably, of the cash that pays for the current system will come from people selling their houses. Now, infamously, it's quite difficult politically to access asset wealth. You know, we're good at taxing income, we're not good at taxing assets, and asset wealth has increased, asset wealth inequality has increased. But as soon as you move in any way to try and get access to that cash, you have a big reaction against it. So if you simply made care free at the point of need, would that not inevitably be a transfer of wealth actually to those people who then didn't have to sell their houses? In effect, people would then be inheriting wealth that they hadn't earned, that they wouldn't otherwise have inherited. So my question is, how do you solve the resource problem? Isn't it actually a tax policy question? However you structure it, whether it's nationally or you leave it in the private sector, to resource it better means a tax policy solution. Or am I missing the point?
You're absolutely, we've been talking about that in Commonweal, where absolutely the solution has to be tax, right? And there's obviously a question of what type of tax, right? But I think what we think is that just in terms of the current system of getting people to sell their assets, right, to pay for care, it would be far fairer on people to actually have a fair system of death duties, for example, right? And that people, a much fairer system of increased death duties, because they've been raised at the moment, the limit, right? And you'd bring that down and pay for this, you could pay for some of the system through that. The people who get mainly hit at the moment of course, and it's a bit ironic, by selling the houses, it tends to be the people who bought their council houses, whose houses weren't worth very much, and their assets get wiped out totally. The much richer people may not touch their assets at all because they've got their housing assets at all, because actually what they've got is they've got lots of wealth locked up elsewhere. So I suppose the resourcing, you know, we think that in terms of assets, we should remove that from at the point care is provided, and have that wider discussion. It poses a challenge for the Scottish Parliament, because of course the Scottish Parliament hasn't got control over death duties, right? Although actually, as people say, one of the things it has got and hasn't used is it's got a lot more power over local taxes. It could do what it wants, more or less. So you could actually use a more general local tax to raise income for that, rather than forcing certain individuals to pay. So I suppose our approach is that would result in a more collective system, because people can't predict whether they're going to need to go into care or not. You know, that was one of the problems with insurance systems. How do you predict who's going to go in there? And we think basically we need a far more collective provision.
Thanks, Nick. Mike?
Hi, Nick. I'm just wondering if your working group have been talking about campaigning as well, and where you go with it. So if you've got like a manifesto for care, is the next step trying to turn that into motions that unions pass at their branches, and then you take it up through the S2UC line? Or more politically, is it something we should be looking to get into all under one banner, and into the, I suppose, the pro-independence movement, on the political side? So anyway, that was the question. Have you been talking about campaigning as well?
I think a little bit. I mean, it's quite a small group of people, and we're quite stretched. So Des has been doing a bit by getting motions. So we have got some links. We are quite well linked in, actually, that, and to Unison we've got quite a lot of links. So we're trying to influence that's what's happening. I think more assistance would really help. We have the manifestos, I think, coming out tomorrow with a set of principles, which we wanted to get out before Feely. So getting that around and for discussion's really good. But I mean, the challenge is how do you, I mean, like all these things, small groups of people aren't going to change anything. It needs organizations to change. So it's, from my point of view, I think, whatever organizations grab this and can run and develop and input it, the better. But we see there is a role for putting out ideas.
Thanks, Nick. Can I just comment on this question that was raised about cash from Chris? Is that I think this is a kind of an illusion, really, that cash is a problem. The way I see it is that the biggest green job creation scheme that's integral to sustainable development in Scotland is in the social care. We're looking at sectors where there's going to be job losses, whether it's due to COVID or other factors like robotics and stuff like that. If we believe in the social aim of having relatively full employment in Edinburgh, then we have to finance social care. It's not just an issue for people in receipt of social care, it's having a sustainable society. And I think one point people need to get is reform of social care is integral to having a fair and equal society. You can't have one without the other. You don't have to search about how we create enough jobs for people. Social care is going to be the main engine of job creation, not only in Scotland, but any country. And we need to grasp that nettle and work out, it simply has to be financed. If it doesn't take place, then it has consequences like unemployment and poverty. It's really, I think, Nick, I think you would agree with that. It's actual finance is not really the big problem if you look at the wider picture. Would you agree with that?
Yes. Well, I think that well, of course, it's the biggest problem and it's the least, and it gets back to that 400 billion, you know, in the hands of 10 people in the world. What their personal fortunes have gone up this year. We need to redistribute wealth. But we also, within the care system, what I didn't say, Chris, is we must, particularly the care homes, a lot of that wealth leaks out. You know, 10% of that is going into the hands of those billionaires and others, and we absolutely need to stop that happening. And you know, part of the unfairness of care is that there are a lot of people being ripped off in the care home system in Scotland, right? And I don't think we should sit by while that you know, people are being charged extraordinary amounts for care sometimes.
Anyone what else coming in? Kathy, I was going to ask you, but you're on the Commonweal Working Group, and what do you think are the main issues as far as you're concerned in terms of the future of social care?
Well, I mean, I think all the things that Nick's talked about are really important. What I was going to say, in a sense, to Mike, to everybody, is that I think we've tried to put together this. I think we call it a manifesto, haven't we now? You know, a set of principles, really. And I would like everybody to be using that during the election to ask candidates, you know, what are you going to do? This is what we think social care should look like. Are you going to help us on this? You know, and actually we have talked about sending it to all the political parties and everything. And the Commonweal itself as an organization, I think will be doing, I don't know whether you call it campaigning, but spreading the word about it and amongst its members and its working groups and things. So that was just one small thing. I mean, obviously we have to do it in every way we can, but in answer to Des's question, I think the thing I would add that I've been saying in the working group is we need to, well, in public health speak, we need to swim upstream. You know, we need to actually work toward prevention a lot more. Because at the moment, what's happening is that I think people's ability to function and live a full life is deteriorating because they're not getting the help as soon as they need it. So at the moment, I think Nick said that, you know, and Carmen said in local authorities, it's only the people with really crucial needs now that are getting help. It's not people with low-level needs, where if they got help, they might not then progress so fast and end up having to be in a nursing home, for example, or something like that. And I think that prevention element is really important, but it's very, very, I know, because I worked in the health service for years, and it's really hard to get funds shifted toward prevention because they always end up at the acute end of things.
Thank you, Kathy. Any other comments? Yes, Chris?
Yeah, might be going backwards. I was wondering if Nick had a perspective on something which I've been trying to get my head around. You mentioned about profit being extracted from the system, and that sounds entirely plausible. I think about large companies. I know there's this curiosity that HC1 posted. It says that it hasn't made any profit over the last 10 years, but it also has complex tax structures. It pays out share dividends. There's the pay of the people at the top. I think the fellow in charge of Barchester, who's just threatened to fire staff who don't take the vaccine, is almost on $1 million a year salary. So it's entirely plausible to me that there's profit extraction, but I was trying to understand where you can go in research terms to get a sense of that. And if you look at there's a report by the Competition and Markets Authority, which suggested it's very tight profit margins. So I just wondered, how do those two things fit together? Is the Competition and Markets Authority missing the picture? Or is it a different picture in Scotland to the rest of the UK? Is there a level of monopoly in different, in terms of the extent of power of large companies compared to smaller providers or independent providers? How do you get a good picture of the structure of the market? I'm sort of struggling to find that with Google. You see what I mean?
Okay, I will. Actually, in my report, The Predictable Crisis, which came out in May, I put some links to some, there's been some excellent research done this, including things on stopping the leaks out of social care. So there are a whole lot of people who are now looking at the financial side. So it is quite well documented. I'll try and send you links to that afterwards, all right? So there is a lot of information about it. I think what we face is, in the narrative, the providers always say they haven't got enough money. And they just continually say you're not paying enough money for care. Now, I was involved in working out a care cost calculator for Scotland. And what I would say is that they are not paid enough money to pay the workforce decently. Right? And that's absolutely true. But actually, unless you bring in something where they have to pay a national pay structure, where they have to pay the workforce a certain amount, there is no point giving them extra money, because what they do with it is it gets siphoned, a lot of it gets siphoned out. And, you know, I've heard cases of, even with being paid the Scottish living wage, right, providers can take the money back by, well, if we just understaff a couple of shifts, all right, you can pay for the pay rise that you've been forced to give to other staff. You can undermine other pay and conditions. And this has been the trend. Well, I've been working in commissioning in the sector and care homes for the last 15, 20 years. This has just been a continual attrition going on. And it's partly why I think we need to get rid of the private sector, is I think it's impossible to control through contracts and things. You just can't, the money makers are always finding another way of getting money out. But the big way it happens too is basically it's been through capital. And so where they make the money and where all the speculation happens is on the capital asset side rather than the actual running of care. They make a bit of money on that, but the really big money and what explained the Southern Cross and so on is speculation on assets, right? And they get traded quite often separately from the care home companies now. There's big US, UK and real estate investment trusts that invest in the capital bits of care homes and hedge funds and so on. So they buy up things, they speculate, they sell, they make lots of money. But that has been going on for a long, long time. I mean, when I started working commissioning in Glasgow almost 20 years ago, I mean, I met a guy in Glasgow, he'd made 10 million quid, right, from being a director of care homes in Scotland, right? And he just took early retirement at the age of 30. That's what he took out of the system. The amount of money that has been taken out of the system by these people is immense. And what happens is then the public sector we end up through paying fees, or people are paying private fees, pay for those assets over and over again. Right? If you think about it, I mean, it's rather like the house market. You know, you build a house, and every time it's sold, the banks make money all over again from whoever's borrowing it. Right? So the banks are continually making money out of it. Well, it's just like that in the care home sector. Finance, they're continually extorting rent out of it. So it's a bit of a rambling response, but they are making significant amounts of money, and that's why over the summer and even during the COVID crisis, with the uncertainty in care, we had, you know, various new deals were announced. Edinburgh Care Homes bought 11 Bupa care homes in Scotland. Well, they didn't do that because they didn't think the whole sector was finished. They did that because they knew there was a whole lot of money to be made.
Thanks, Nick. Bruce.
Yes, good evening, everyone. I'm the NUJ rep on the Trade Union Council in Edinburgh, and I promised to try and be more in attendance this year. I've just shared a copy of an article from Private Eye from 2 years ago about HC1, and I'll just read you a couple of lines from it. Even after interest payments have tax efficiently all but eliminated UK profits, leaving less than 2 million in tax last year. There's still plenty more for the overseas owners. Last year, this is 2 years ago, they received 6 million in dividends, and the year before that, 42 million. So that the reason I noticed this was because my mum had just gone into an HC1 care home in Dunfermline. And I'm sad to say that she died after 1 year in there. I honestly don't believe she would be dead if she'd gone in there, but that's another issue. So there's a bit of information there. It's from Private Eyes, say 2 years ago, and it goes into quite a bit of detail about their tax management, tax deferral, tax avoidance, whatever you want to call it. But hopefully that will be useful.
Thanks very much, Bruce. I look forward to reading what you've put on chat. Any response to that, Nick? HC1, that's one of your enemies.
Well, it is. Yes, I mean, all these big providers are just. I mean, there's nothing good to be said about them. I mean, basically, the City of London and its financial practices have seen a chance to make money out of care, and that's what they're doing. I suppose the issue that we face at the moment is that it's still not an enormous sector of the market in Scotland, right? So, and the issue we face actually partly as a result of COVID is that smaller providers are quite likely to go bust. There is likely to be more consolidation like what's happening across, you know, like in the retail sector, everywhere else, capital is consolidating. And so I think we do face a risk at the moment of providers becoming even more, you know, small providers being bought out and being taken over. And what I wouldn't deny in it, there are some quite reasonable small providers, you know, who do quite a good job. But the problem is they're always at some stage going to end up selling out to someone else.
Thanks. Any more questions or comments? I'm looking around. Kathy, good.
The financial side of this is not something I know very much about, but I had a friend who I was helping look after, who was in a care home, who I would say thankfully died before COVID, because it would have been so horrible for her. But that was a Four Seasons home, which is a big private provider. And they went, I don't know whether they went bust, but they basically had to get rid of a lot of their homes. And when I went in to talk to the administrator and the people who ran the office, who, by the way, didn't get the living wage, the Scottish living wage, the social care workers did because the Scottish government said they had to, but the admin workers who kept all the books, who kept the place running, they didn't even get the Scottish living wage, which is one of the things Nick talked about that's how they, you know, if they're told they have to pay the social care workers more, then they pay other people less. But anyway, they told me that that particular care home had been bought over by an American company. And the only reason I'm mentioning that is because I know with, well, just generally, but with Brexit and with free trade and God knows what, that there are a lot of American companies eyeing up the UK health service. But I think they're also going to be eyeing up social care. Where can we get, a foot in the door? And although my understanding is, although the Scottish government has said there won't be private provision of healthcare, they haven't said anything about private provision of social care. So I think that's all part of the same issue.
Thank you. Anyone else? I'm beginning to look at the time, so it's now 22 minutes to 8. So I'm going to ask at about like start after 10 to 8 if Nick has got anything to say to wrap up the discussion, so we can finish at 8 o'clock. I'm quite interested myself, I say as a chair or secretary, but you see, people have touched on what campaigning should we be doing. And we've talked a bit about motions, and we talked a bit about being at trying to make an issue in terms of lobbying political parties between now and May. But I think it is actually quite a big thing to consider as how trade unions should campaign on this, because I know for myself is that people doing a social care job in a local authority, working for a local authority, can be paid £4 or £5 or £6 an hour more than someone working in not only the private sector, but even the not-for-profit sector. And it seems to be, from a trade union point of view, it seems amazing that local authorities should be funding same jobs at radically different levels of pay. And I'm surprised that not more is done about that. So I think this issue of the two rates of pay is, and the local authorities have more of a career structure than the private sector or not-for-profit sector, and why that isn't in itself a campaigning issue right now is something can't really give a proper explanation of that. But anyway, is there anyone else want to make a contribution, given that we've got another 10 minutes or quarter now before we have to really wrap up? Anyone else? If not, no one else wants to come in at this stage. Before I make my final remarks, I'm going to ask Nick, really, is there anything else that he wants to say in sort of following the sort of discussion we've had and given what's going to happen over the next couple of weeks? Nick?
Yeah. Well, thanks very much for listening to me. I just wish we knew what to do. There was an obvious, and I think it is very difficult because we're in a very obvious state of crisis. I think people know that there's a crisis. There's a crisis in the care system. There's a crisis in care in society. There's a wider crisis, societal crisis. And actually what we all face is that none of us really know what to do about it, and I mean, the best I can see is that people build, try and build organizations, and that within that context, for the people who work in the care sector, building the unions in the workplace and so on is absolutely crucial. But I mean, we all wish we could wave a magic wand, and I think we're all struggling with it. So anyway, but thanks very much for listening.
Kathy?
Yeah, I just think, just from what Nick's saying, that within the trade union movement, I think the two things we can really campaign for, or push for, or work for within trade unions is, and it's one of the principles that the Commonweal Manifesto says, is that there should be national collective bargaining for social care workers. And I think that's a very specific demand that we can make. It's something that makes a lot of sense, and that has examples like the National Health Service and education and things that can be used. And I think so that's a very specific thing. And although it wouldn't solve everything, it certainly would deal with some of the problems we've been talking about if there was a strong central national collective bargaining structure. And the other thing is, we should be really pushing to unionize social care. It's very difficult because it's so disparate. But I think even in the voluntary sector, it's pretty poorly unionized. But in the private sector, it's terribly low unionization.
Okay, anyone else?
Yes, could I speak? Yeah.
Donny?
Yeah.
Donny, right?
Thanks. I mean, I think Nick asked a really important question, and since we're part of the trade union movement, the lesson, I think, of history is absolutely clear, that we all rise together or we all fall together. And in a sense, it's that question of solidarity, of building the strength of the trade unions, the power of the trade unions. And there are examples that you can point to. You know, I mean, there was the huge crisis about PPE at the beginning. What action could people take? Well, if you look at what was done in the schools, for example, around Section 44, when they were pushing people back into the primary schools in England. So there was a mass use of that, and it turned over the government very, very quickly. I mean, we've used it in further education. We've used Section 44 again to it's not the same because it's, you know, care homes, you can't just walk away. I mean, well, you can, but it's much more difficult. But it's the question of building that confidence from below that I think can be done. If you look at the gas workers at the moment, they're out on strike against fire and rehire, and if they win, that gives the potential for everybody to be stronger in terms of bargaining and demanding and getting involved in trade unions. And if you look at the history of trade unions, it's not a gradual accretion. It's somebody sets the spark and other people unionize. That's how unionization takes place. It takes place in waves. You know, I teach history, so you can go back to the dock strike in the East End of London, which started off, and we would not have Unison, we wouldn't have GMB, we wouldn't have Unite, if it hadn't been for the fact that one small group of workers took on the bosses, won, and all of a sudden unskilled workers discovered that if enough of them went out together, they could force the bosses into retreat. So I do think, you know, you can, if you look at care in isolation, I think it's quite depressing in a sense, because it's got inherent problems with it. But as part of the trade union movement, it can lift. And so, I mean, I'll just mention, I've talked a long time, but People Before Profit has that idea of delivering solidarity across different sections, you know, around the country, connecting them together with furlough, with all those sorts of issues, COVID, et cetera, et cetera. And that's the sort of attempt that is being made, because, you know, it's, what is it? We all hang together. We hang, I forget the phrase, you know, the one of, you know, we've got to unite, and it's that unity across the trade union movement that can actually solve the problem in care, because the problems are clearly massive, you know. But I think that's as trade unionists, that's the sort of way we would look at it, wouldn't it be?
Des, if I could come in?
Yep.
But perhaps in this example, that there's a case to be made for a membership organization like a union, but representing the clients, the care home residents and social care users, which would work in partnership with the unions to help the staff, because, as someone said, that, you know, the industry is very disparate and you know, atomized, and it's hard sometimes to organize in some of the care homes. Maybe so another approach from the client side might be possible. I don't know.
Any comments on that, Nick?
Yeah, yes, and sorry, my last comment was a bit pessimistic. I think it came across a bit pessimistic, and just I was struggling. I'm not actually pessimistic. I think actually we've got a great opportunity for change, but it's just like seeing how that change is going to happen. But I think on that last comment, I think one of the ways there is a huge interface with the users of services and informal carers, and I think we really need to be thinking about it. And one of the things that the Commonweal, what we're talking about, is about democratizing services. So we're thinking, and to give an example, I mean, in terms of care homes and allowing relatives to visit safely and things, I honestly think we would have done a whole lot better if trade unions and the relatives and the people who are in the care homes, who could speak for themselves, have been able to get together and sort out what was possible. We would have got better arrangements than what government's actually done. So people may disagree with that. I don't know. I'd be interested to see. But I think there's a whole lot of things about care that would be much, much better managed by people who are at the front line. And I've mentioned earlier about workers having more control about their working time, but I think there's a collective aspect for it. And that would absolutely allow people, you know, then in terms of carer organisations and organisations representing service users to come together. I mean, I think the care homes and older people with dementia representations are a really problematic issue, and for obvious reasons, but there are other groups who absolutely could organise, you know, and including, for example, young people in care.
Thanks. Someone's got something urgent to say. I noticed there's adverts in the chat about another Edinburgh's possible meeting on Thursday the 4th. I hope you've noted that. And thanks, Bruce, for that article in Private Eye. I suppose the final thing I want to say is that Feely Committee report is going to become public on the 5th of February. The Edinburgh TC's next meeting is on the 9th of February. And I think that I'll want to prepare a sort of, whether it's a press statement or a motion, I don't know, but something at that meeting on the 9th, I hope to have on the agenda a sort of response to Feely, a brief response to Feely on behalf of the local trade union movement. So if people are interested in that Feely report and what it's saying, then it will be debate at our meeting on the 9th of February. And those people are, it's a Zoom meeting, of course, those people who aren't delegates are still welcome to observe that meeting and the parts of it that's going to deal with the Feely report. So with that, Claire, thank you very much for attending this evening. You should all have my email address anyway. So if you've got any views, further views on what's going on, given what you've heard tonight, or any other feedback you're getting, please let us know. And thanks to Sophie for recording the meeting. So we hope to make that recording available to our network too. So if you know anyone who's going to be interested in discussion tonight, then we can send them the recording. So with that, thanks very much, and hope to see you. Yes.
Yes, we'll upload it on the YouTube channel, and then we can circulate the link, and everybody can watch it.
Okay.
Okay. So I'll upload it there. Okay.
Thank you. So I'm going to close the meeting now. But thanks once again for coming along and joining the discussion. Bye.
Thank you. Thanks, Nick.
Yeah, thank you. Thanks, everybody.